Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvi Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Ashley Broadrick, registered dietitian at Vitruvi Healthcare System.
Thank you so much for having me.
And today's conversation tackles something many people struggle with, figuring out who to trust when it comes to nutrition advice. Between social media influencers, trending diets, and conflicting headlines, it can feel overwhelming to know what's actually backed by science. And that's why today we're talking about the role of registered dietitians, healthcare professionals trained to translate nutrition science into safe, practical information. And Ashley, many people don't realize there's a difference between a nutritionist and a registered dietitian. And what sets that apart?
The title of having a registered dietitian really just recognizes there is a rigorous academic training. We complete extensive supervised clinical practical hours in a healthcare setting. There's a certification that's required, continuing education each year, licensure within the state. It's healthcare training, not just personal interest or an online certification. So there is a lot that goes into what the registered dietitian certification actually means and represents in the medical field.
I mean, why is that level of education so important for patients? It seems like a pretty necessary process there.
Yeah, so I think nutrition directly impacts medications, disease management, recovery. Incorrect advice could worsen medical conditions. RDs are trained to evaluate labs, medical histories, treatment plans, and we utilize evidence-based guidance to protect the patient's safety. So patients deserve recommendations that are grounded in science, not just the trends that we might see out there.
That's a good point with just like trusting the science, and it kind of goes into my next question of what's going on online with just all of the advice people give that might be, trying to sell their products or trying to trick people for some reason. Why is there so much misinformation?
Yes, I think it's just information overload and just the accessibility that we have in the world now. So, and in our culture, I think quick fixes and dramatic claims really can attract attention, right? Mm-hmm. So anyone can share their opinions without any base of training. So that is very true in nutrition. For sure. So algorithms reward the sensational claims and not necessarily accuracy. So people may try different restrictive diets that could be inappropriate for their health. And that confusion can either lead to people being discouraged or giving up, but it also can be harmful. So I think, it's very, when we talk about disease management or chronic disease, like there's really no one size fits all that happens in the nutrition world.
And how can somebody tell, because not to discredit everything you read online, but how can somebody tell if nutrition advice is actually trustworthy?
Yeah, so when you're looking for credentials like RD or RDN, LD, that's going to show your registration or licensure. So it is indicating that there's been a level of education and training that's gone in for that individual. So evidence-based nutrition rarely eliminates food groups unnecessarily unless it's truly medically indicated for a disease state. And that would be very specific of in a clinical setting that you would be looking at those things. So reliable advice considers long-term sustainability. Healthcare providers and registered dietitians collaborate using research-backed information. So being cautious of promises of rapid weight loss or miracle cures and looking for good resources that are sound in what they're putting out there in the world.
There's definitely a lot of people that see dietitians as just something to help lose weight. Are there other actual applications of this?
Yeah, so you might see dietitians and diabetes management with blood glucose balancing through diet, exercise. Kidney disease is incredibly important, so that requires a lot of careful nutrient monitoring. So we're looking at labs. We may be looking at how even the protein recommendations that are out there for the general public would not be indicated needed for people with kidney disease. So dietitian becomes very important in that medical setting. GI disorders like IBS, inflammatory conditions, cancer support and recovery nutrition. We work with heart disease prevention, cholesterol management, and malnutrition or weight loss during illness. So dietitian's an integral part of the healthcare team in managing those things.
You mentioned being able to look at different lab values and stuff. And is that a pretty big difference between this, regular eating advice and, the medical nutrition therapy that you can provide?
It really is. I think that a dietitian is going to be able to use lab values or a physician diagnosis to kind of look at the trajectory of caring best for the patient and what the setting may be. We look at medications, if there's any kind of contraindications for nutrition recommendations, and we also look at treatment plans. So nutrition can help reduce complications. It can help with hospital readmissions, but feeding the body internally is going to be so lucrative with getting someone healthy and recovered when it comes to the clinical setting. So goals are going to be very different between the different patients and chronic disease states and their acuity of illness specific to the hospital setting. So dietitians are very involved with critical care and different aspects. So patients are going to receive ongoing adjustments as their healthcare changes or even their nutritional status either improves or declines, and we kind of work alongside the medical team in that setting.
Well, what other ways do you work with the actual, hospital and healthcare team as a dietitian?
You're going to see a collaborative team approach with a lot of different disciplinaries. So physicians, nurses, pharmacists, therapists, and of course the dietitian can really come at different aspects of care that go into overall healing and health. A dietitian is going to really look at the nutrition, how it influences whether it's healing after surgery or illness, going into those two things like surgery can be really helpful. We aid and make recommendations that might prevent complications of either muscle loss or nutrient deficiencies. Communication with the team can ensure consistent care and also impact hospital stay or just the trajectory of healing for the patient as a whole. So a patient definitely benefits when nutrition can be integrated into the treatment rather than added later.
Yeah, I'm sure that as patients overall, with a strong team, with just everybody being at the top of their game, will just have direct benefits from that. And beyond the hospital, how do registered dietitians support community wellness even?
Yeah, so kind of like what we're doing today, right? So community education programs, health screenings, cooking demos, nutrition classes. You may be able to find those in your community. Preventive counseling for heart health or diabetes risk. I get to work in the cardiac rehab setting, so we do a lot of talk after as you're trying to recover from a cardiac event. So what's the importance with that? Supporting families that are learning together. So a big diagnosis or, you think of kind of health as something that lands you in the hospital can be a life-altering diagnosis, right? So dietitian can come alongside that and just kind of handle that burden along with the family of what that looks like, of kind of their new normal or how to incorporate healthy choices in the different settings. So collaborations, whether it's schools, workplace, local organizations, there's a lot of different places that you might see dietitians able to support. So helping people stay healthy before the illness develops, but then also helping them navigate life in a post-illness setting.
Oh, so if somebody today is listening and wondering whether they should get started seeing a registered dietitian, what would you tell them to convince them to?
Yeah, I think, a lot of people, I think they hear the word nutrition or maybe they hear dietitian and they think of, okay, this is somebody that's going to have a lot of rules and rigidity and tell me to only eat vegetables. And that's just really far from the truth, especially I think of my cohorts that we really desire to help with prevention, energy, everyday wellness, but then also trying to get you able to be your best version of yourself. And so nutrition's a huge part of that. Personalized support can help remove guesswork. Small adjustments can help overall with success of whatever the goals are. And the expert guidance, I think, especially as an influx of information that we have available to us, can really just take out some guesswork and some legwork for people. So you don't need a crisis to benefit from nutrition counseling or to see a dietitian. They're really a good resource that can be available.
Well, Ashley, thank you very much for helping us just understand how important registered dietitians are in today's healthcare environment. In a world full of conflicting advice, it's reassuring to know that there are experts dedicated to evidence-based, compassionate care. And as to our listeners, if you'd like to learn more about nutrition services or wellness resources available through Hamilton Medical Center, you can visit vitruvianhealth.com.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.